Thank you, Commissioner. Wanted to touch on the exchange and the costs. I know originally the intention was to have it self-sustaining. We've had costs in the current fiscal year, and then we have proposed ones in the upcoming one. Are we increasing, decreasing in that, or staying about the same?
We've had, from the exchange, we have 2.7, from the standpoint of people, we have 2.7 million people now enrolled in the exchange. We have a state with only 6% uninsured, which is down basically in half or close to in half from where it was before. We have more enrolled, obviously, as Jason has mentioned, about Medicaid. We have a budget that's $575 million that is coming from the federal government, I believe, and $484 million that's cost for it to run the exchange or for the exchange. We are making progress on that. There is also funds from the federal government, and as we are moving towards more of an essential health plan, which is sort of the basic health plan, we will have additional savings of probably about $500,000 on that.
So do you think going forward then we'll see increasing costs net to the state, or
Yeah, so I probably answer that because in addition to the launching of the health insurance exchange and the qualified health benefits, the tax subsidies that are provided to help individuals buy commercial insurance, we implemented in New York that initiative. At the same time, we also implemented, basically created a one-stop shop for people to access health insurance, and that includes the Medicaid program. And if you look at the 2.7 million people who have used the exchange to date, the vast majority of those people are actually accessing using that service to access the Medicaid program. And what we're in the midst of doing is a multi-year takeover of the responsibility for Medicaid administration from the counties. And so, your question is, will the budget for that centralized function grow? And the answer is yes, it will grow. But at the same time, the amount of money we spend at the county level for the administration of the Medicaid program will decline. And we think at the end of the day, the net cost of administering that system, that single unified system, that single one-stop shop for healthcare, will actually be less than what it cost us to administer just the Medicaid program on a county basis.
Jumping to a topic that I brought up before on the executive order on immigration, I know it's been discussed some today. Do we know the numbers that are going to be impacted by that in this fiscal year? And again, do we see that as a increasing item in the future?
I have to go back and look at the fiscal for the executive order. I mean, actually, I think as was the Commissioner mentioned, the creation of the Essential Plan, which was an initiative in last year's budget, generated substantial savings to the taxpayers of New York. And the reason was that we had this population of legally resident individuals who are not here illegally, but are not eligible under federal law for Medicaid, but are based on our Constitution on the program. And so we were funding those expenses to the tune of almost $1 billion a year, and that was entirely state-only funds. And what the Essential Plan allowed us to do was, we know in the individuals who made the transition from Medicaid to the Essential Plan are different. They got the same benefit package, same cost sharing and everything, but we were able to avail ourselves of federal funding through that program to cover the vast majority of those expenses. So as a result, the cost of legally resident but non-qualifying, as it's referred to, immigrants to the state of New York has been substantially reduced because of that initiative. That said, we'll get you more information about the fiscal that went into the President's executive order, which is obviously still remains stayed.
Thank you. Also, there have been comments or questions related to the Donate Life Registry. I guess I would just ask the question, and I know you made some reference, Commissioner, to saying, that we're going to be making progress on that. I know we've had, among the lowest donor levels, I guess registry levels, and donor. Have we made any progress on those items specifically yet, or hope that we will in the state?
So we have about 4 million people registered as organ donors in the state as of the first of this year. And as I mentioned, the award has been finalized and it's now with the controller, so hopefully that will help move forward. I think and once that is awarded, then all the efforts to further outreach to get more people registered will happen. I know there's been a lot of discussion about other ways to do this and partnering with other agencies as well, and we'll see what else we can tackle.
We'll look forward to that happening. One final question, I know that in last year's, or the current year's fiscal budget, we had enacted some provisions to help with exorbitant out-of-network costs as it related to some of those expenses with the Affordable Care Act and out-of-network. Have we made some progress during this past year on that issue?
Are you referring to our plans, the marketplace, or are you referring to in general? Some of these issues are also DFS issues that we should tackle.
Well, I was looking at it from the perspective of what we had enacted. We put in the budget to make, my understanding is to make some changes so that we could have some impact on reducing some of those out-of-network exorbitant costs and trying to rein those in. And I was just wondering if within that we'd made progress.
Yeah, I would say that I think that question is probably best directed to Department of Financial Services in the sense that they were the leads on negotiating that language, and they're the ones who are monitoring the implementation. But I think that the issue that you get to, which is the concern that when individuals, for whatever reason, end up out of network, whether it's they have an emergency, they're picked up in an ambulance, they end up at a hospital, it's not in network, and what kind of charges do they potentially face? I mean, that was the concern that I know a lot of people across the healthcare system had heard, was that bills were going to be sent to these individuals that were going to be exorbitant, and how could, or in their insurance companies, and how could we prevent that? And I think that's, DFS has really taken the lead on the enforcement of that act.
Thank you.